Hello, everyone. This is Dr. Samantha Benjamin Allen here for another episode of Thriving Through Trials, the show that's dedicated to bringing hope and inspiration to those facing debilitating or potentially debilitating diseases and challenges. Again, I'm Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, and founder of Freedom Wellness Physiatry, a direct specialty rehabilitation consultancy serving the DMV in the home care setting. In this show, we'll be shining a light on remarkable individuals who have not just survived, but thrived beyond their circumstances. We'll be exploring their journeys, their resilience, and the strategies they've used to regain mobility, independence, function, and quality of life. Our goal is to empower, encourage, and motivate you, our viewers, and provide a source of inspiration in the face of adversity. So join us as we uncover stories of triumph and learn how to thrive through life's toughest trials. Today, I am pleased to introduce our amazing guest, Ms. Grace Taylor. Hi, Grace. Thank you for joining us. Please introduce yourself.
Hi, thank you for having me. My name is Grace Taylor, as Dr. Benjamin previously mentioned, and I am a registered nurse. I have been for over 35 years, and I work in various areas of nursing. I have three wonderful children, two of which are married and happy, and I'm happy for them. And I currently work in a clinic. It's a health center where I'm the nurse manager.
Wow. So you are a busy lady, three children, working as a nurse manager, married. You got a lot on your plate. So
Yes.
I'm honored to have you today. All right. So this episode is entitled Thriving Against Breast Cancer Odds. So I'd like you to share a little bit of your journey from being diagnosed with breast cancer and uh, to where you are today. Briefly share that story with us.
My diagnosis was in 2013 in October. And prior to me being diagnosed, I was told that I'm supposed to go for a mammogram. First, I was sent to my OBGYN because I felt a lump was felt.
Mhm.
And I went to the obstetrician,
Uh-huh.
but after I saw the OBGYN doctor and he said he thought it was fibrous tissue. Plus, I have no history of breast cancer in my family. And
Wow. So you're the first one in your family to ever experience this, huh?
yes,
Wow.
yeah.
Okay.
And I used that to delay my decision to go to get the mammogram done
Uh-huh.
because of the reality that there was nobody in my family. Plus, I am a very healthy person. I run like 14 laps, eat healthy, do everything. So there was no way I would have thought that that was cancer. So
Now,
that
were you, sorry, I'm
point,
going to interject and ask you a question. Were you regularly doing breast exams or how did you discover this lump?
that was literally discovered by my husband.
Ah, okay. Well, thank
And
God for your husband.
and then the thing is,
Findings that we weren't even paying attention to. So good, good. Okay.
but you know what sometimes fool us or fool me for that matter? It's like when you're ready to go to the doctor for something, then it feels like it's gone.
Uh-huh.
So I felt like it disappeared.
Yeah.
So then I feel I don't want to go and I feel like an idiot. So I said, I'm not even going. So really before I went to my primary care, I delayed in going to seeing her too. And
Wow.
then after I went to see her, and when she said she just wrote me the referral to go, I felt like it disappeared again.
Mm.
So I didn't really rush to my OBGYN after. So there was a couple of delays in between.
Oh,
And then also when my OB doctor said he felt it was fibrous tissue based on my history, and I didn't have any reason to think that it was, I delayed also in going to do the mammogram.
I see. So what was the time frame from the lump being found to you actually getting the diagnosis or the mammogram done?
I would say it's almost a year.
Wow.
Yes, it's almost a year, I think. And what forced me then to do that is that I saw some significant signs, some classic signs that I remember from nursing school that they would talk about the retracted nipple,
Mm-hmm.
looks like a grapefruit. And that's my experience then. So I said, oh, this might be something.
Yeah.
And even with that, I was still kind of wanted to delay because at that time, I think my mom passed right at that day. And I spoke to my
Mm.
sister who was in Florida with her,
Mm-hmm.
and I was telling her what I was finding, and I was gonna book my flight to come over. She said, "No, do not do that. Just go to get your mammogram done." So she insisted that I stayed on the phone with her
Mm-hmm.
until I made the appointment. So I made the appointment then at that day. And then when I went to them and they did the mammogram, then that same day they said, I have to get something else done, which
Mm.
was the ultrasound.
Okay.
Be- Apparently they saw something. So they
Right.
called and asked for the order to do the ultrasound by the OB doctor. Luckily, he was there still. And he said, okay, go ahead and do that at the same time.
Okay. And just for viewers who are listening, in the medical world, we call this peau d'orange or peel of orange. So it looks like an orange peel. The breast takes on that type of texture. You know how those tiny indentations all around the orange, just for those who are wondering. So that is something to look out for if you have any suspicion. So thank you for mentioning that. Now, along the journey after diagnosis, what was the thought process in your mind on what should be done about it? Like what do I feel I should do versus what are they saying I should do? How was that for you?
The truth is that I didn't want to even think about it at the
Mhm,
same time because when the radiologist was talking to me at that day and he was telling me a lot of stuff, I stopped listening to him once he told me that it was that. I
mhm,
literally stopped listening to him. And the last thing before he walked out, he said that I should go get an oncologist to see me. And then that's pretty much when I sat up, because I
mhm.
was going back all this time. And I said, what did you say? It's almost as if I heard nothing before that.
Right.
And I said, what did you say? And he said, yes, you have to go to see an oncologist because you have breast cancer. And I said, okay. And I just walked out of there and came home and I called my sister right away. And as much as I am a nurse and I know about all the things that I should do, at that time it felt like I knew nothing. So I was relying on my sister to tell me what to do.
Yeah, and it's overwhelming to get news like that.
Yeah.
And I can imagine denial is a part of it. And being a healthy woman, exercising, eating healthy, doing all the things you're supposed to do in no family history, it's like, what are they talking about? Maybe they made a mistake. So I can I can hear I can hear that for sure. And being in the medical field, both of us as medical providers, sometimes there are assumptions made that we know what to do. But when, truth be told, when it comes down to it being personal, it's like
Mhm,
it goes out the window. And
mhm.
like even when I had my children, I was like, don't assume that I know what I'm doing. I want you to tell me everything like a patient who is not in the medical field. Tell me everything because I'm overwhelmed and I can't think straight. So yeah, I hear you. Now
Right.
tell me, yeah, go ahead.
Because I just wanted to add that within that month, actually, before I was diagnosed, I was taking care of a patient that was diagnosed with cancer.
Oh
And
wow.
I was dealing
So
and
you knew
telling,
everything,
and I was telling him what to do. And when it was
right?
my turn,
Once
it
your
was as
turn,
if
it's
I
like,
knew nothing.
yeah, that's life. That's real. That's real. All right. So um after the conversations with your sister, did you decide or what treatment course did you choose to undergo? Did you do chemo, radiation? Did you do none of those? What was your like lifestyle changes, a combination of all of the above? What was the method?
Prior to my diagnosis, I was doing, and I did a nutrition course as a nutritionist. I went to IIN, that's the integrative nutrition, and I did all of that. And while I was doing that course, I remember someone talking about her mom that had breast cancer,
Mhm.
and she went through chemo and all of what she did. And she felt like if she had known what she knew then, she
Mhm.
wouldn't have allowed her to do that because she just watched her go downhill with the chemo. And so all of that time in my head, I have always said that if I were to be ever diagnosed with that, I wouldn't have done the chemo, but I
Mhm.
knew that I probably would have taken the surgery and probably radiation to remove it. And I felt like if I do all of that, then there's no reason for me to do the chemo that would just eat up my cells because it eats my normal cells as well as the chemo cell, the
Right.
cancer cells. And I felt I didn't want it. So I always had it in my head that I wasn't going to do that. So that's one thing that I never took. But I did the surgery and I did the radiation, those two things, but I never did the chemo, even though they wanted me to,
Mm.
because it was really in both breasts. Eventually, that's what happened. It was, and
So
also,
you had a double mastectomy?
and it was in my lymph node, correct.
So was that stage three based on what they, okay. So stage three, it had already gone into other areas from the breast into the lymph nodes. So you also had lymph node dissection?
Yes, it was
Okay.
in,
And how was the aftermath in your mind in terms of your sense of self? What would you say? I'm trying to draw from your experience for those who might be at that place. What would you say brought you through or continued to motivate you to keep going?
my family.
Mhm.
They were the biggest help for me because if it wasn't for them, I couldn't survive. Because many days after the surgery, it's as if you're lost and your concentration is not the same. I because I spent hours under the anesthesia for one, and after that with having all the bandages, the dressings, the drains, you know it I have to go through, and the
Mm.
pain, it was really horrible. So it was hard for me to function on my own. So everybody was just helping. People from my church came and visit me, cook for me, help to feed me. It was just the support that I had that helped me through.
What a blessing. So, what would you say in the midst of all that? I know you had a lot of hands coming in and to support you. What would you say was the most helpful thing for you going through that phase? Uh, because we have, patients and caretakers, caregivers who might be listening. What would you say was the most helpful thing someone that did from a caregiving role for you that maybe is not something people verbalize easily? Because sometimes when we're going through something and we need help, we're so overwhelmed, we don't even know what to tell people to do to help us. They'll say, "How can I help? What can I do?" And you're like, "I don't know, just I need help, but I don't know what to to tell you." But what would you say was the most helpful thing for you?
Just to take a bath. y-
Mm.
And you think that is simple, but with the drains and everything that you have in you,
Mhm.
you can't manage it by yourself.
Mhm.
To take a bath was something that I had to get a seat, uh,
A tub bench, yeah.
yeah, in
Mhm.
my shower and to sit on it and for people to bathe me and dress me because when they remove the lymph node, it's kind of make your arms tight. So it's hard for me to raise my hand and everything, even though after several years, my hand is not the same. My left hand, because they didn't remove lymph nodes from that arm, I
Mhm.
can raise it and move it up to my back, but my right arm, it's still difficult. It doesn't go as far. And
Mhm.
then several surgeries that I've had in the past as well. Even with therapy, they can do so much, and I stretch and I do a lot of exercise still, but it's never the same. So you have to
Yeah.
accept changes that's going to happen to you in your body, and it's going to be for a lifetime. And I know that I wanted to live. So anything that I had to do to survive,
Mm.
that's what I did. And somebody getting there to feed you and getting food for you, just the regular ADLs that you had to do, that was challenging when you think that you are so independent and then you become dependent on somebody. But
Mhm.
luckily for me, the people that I was depending on, they never get weary of doing things for me. And so that made me feel better, because when somebody becomes aware of doing it, then you're going to feel guilty that
Right.
you're wearing them out and you
Hmm.
are trying to do it yourself even though you can't. But I had that great support. I'm telling you, I don't even know what to tell you how much I thank my children, because they were right in my corner.
Wonderful. And for those who don't know, ADLs are activities of daily living. So these are the basic things we do on a day-to-day basis that we often take for granted. Bathing, dressing ourselves, toileting, grooming, eating. These are things that many people find simple, but going through a challenge like this, oftentimes you depend on someone to do all of that. So it is also a very mentally challenging experience if you're a very independent person to go to a place where you have to depend on someone to do everything for you. So thank you for your vulnerability and sharing that aspect of the journey. And I wanted to ask you, now that you had treatment and you did the mastectomies, when were you clear? When did they say no more cancer, everything's good? And did you have any remissions in the process, or has it been smooth sailing since?
No, it wasn't smooth sailing. I didn't take the chemo, like, but it didn't mean that I didn't do anything about it, because they do count every time when you go
Mhm.
to get your blood work done. And I would see the oncology. There are three different types of oncologists. You have the surgical oncologist, you have the medical oncologist, and you have the radiologist, which is an oncologist as well. So I remember that my blood count went so low. And the first medical oncologist that I used to see, he did not want to really treat it, because he thought that I really should have done the chemo. And because I didn't, he didn't want to take me on and do much
Oh
for.
boy.
So
Okay.
I left him, and I went
Hmm.
to my primary care because my blood count was just dropping low.
Yeah.
And
I
he
don't
said,
blame you, to be honest. I don't blame you, but
yeah.
continue. Hmm.
So she sent me to a hematologist, and he did a lot of testing with iron, blood, everything. And then he would do also the cancer cell count every time, and to see if the numbers were going down. And
Hmm.
during that time, I was doing a lot of juicing and doing a lot of different teas that I know would kind of help me with getting rid of the cancer out of my body. So every time that he did the count, the numbers were going down, and he said, "That's very good. So keep doing what you're doing," because he was okay with me not taking it. And as
Uh-huh.
long as the cells weren't getting
Worse.
increased,
Right.
yes, and he was okay with me not doing that. But then also, I had to be transfused. So I was transfused 5 days straight with iron,
Wow.
because of the level was very low. So
So I
he
can
did.
imagine you might have been very weak once your levels had gotten that low.
Mhm.
Um, were were you still at a place of depending on others to do things for you? And I guess my question is, when did you transition from the dependency to kind of reintegrating into society and going back to work?
It took me a long time, because I had to go to physical therapy every other day, and I wasn't able to drive myself. One of the things I remember too is that it feels like I wasn't able to walk straight.
Mm,
I
uh-huh.
was kind of always stumbling. And I remember calling the friend of my sister that she's the one that actually told me what oncologists to go to. And I went to Howard County and all that.
Mhm.
And she said, you'd be surprised, it doesn't just affect just your breast. It's like it affects your whole body. And I found
That's
that's
right.
how I felt
Yes.
because my whole body felt different. And
Mhm.
so I wasn't able to walk straight and I just felt dizzy and all of that. And so I had my children take me to all my appointments all the time. And that's what happened. So I wasn't driving for myself for a long period of time. And sometimes when you go to physical therapy, the pain that you have afterwards because the stretching
Right.
and it was so hard. I'm telling you, it was not an easy journey, but I was determined to make it. So that's one of the things that sort of bring me through.
Thank you. So I'm going to pull a couple points out from what you said that I think are very important to express. One is the partnership in the oncologist that you did find who's willing to work with you. That is very important, folks. You want to be in a partnership with your physician so that your needs are being met and you also have some say in what is happening to you or in your body. All your questions are getting answered and you guys are working together to achieve an optimal or improved outcome for you, rather than someone who's dictating it all and saying if you don't do it this way then we can't do anything. You want to consider exploring other options. So that was a key thing you said. The other thing, which is so true, is the tightness that comes in the axilla, which is the fancy word for armpit. So the lymph nodes that come from the breast tissue, they go into our axilla. So if there's any infiltration or malignancy in the lymph nodes and they're resected, that scar tissue that forms tightens. And it's
Mm.
like, if you can imagine a burn victim, how that skin contracts. And if it's not stretched, you can significantly uh, decline in mobility. And our shoulder is so important for us to wipe ourselves, to wash, to get things from, a counter or cook, whatever. It's so important. And again, I say we take it for granted until we can't do the things that we used to do. So that's something that's very common in breast cancer. So I wanted to stress how important it is to be diligent about your therapy and your rehab and doing it at home as well. So even when your course of therapy is done, when you go to a clinic or an office, you want to still be doing your home program. And it sounds like, Grace, you were diligent about doing what you had to do because you were determined to live. And that is key. You have to set your mind and make a decision that you are determined to do all that you can do, all that is in your power to do to get better. So thank you so much for sharing that. Um, is there anything else that you wanted to say in regards to that?
Yeah, in addition to the radiation as well, also is another thing that helped to cause scar tissue as well, because I got radiation burns. And so that even helped to even tighten the area more. And
Mm,
of course, I had several surgeries because they had to do flap to patch the ear because my breast burnt. And so
oh, wow.
they when they had the implant put
Hmm.
in,
Hmm.
they had to remove it several times. And so I literally end up with like 13 surgeries to do the
Wow.
repair. The flap is another hard one when they cut your abdomen and take that flap off and put it there. And then also that tightens, and that skin wasn't meant to stretch as much. So
Hmm.
when that goes in there, it's hard for that area to stretch. So they put expanders in, and after the expander, then they have to take that back out. And then the implant, it can't be just a one big size. So they use a lot of fat to
Hmm.
graft it, and it's over a process of time to get it back to somewhere that it may look like a normal breast, but it's never the same when, of course, the nipple was gone. So I had to
Hmm.
get that one fixed. And I'm telling you, it's a lot of time and a lot of will that you have to really put into doing it because it's not a walkthrough. And in between that, of course, I met an accident. So that compounded the problem. And there was just other things that happened to me right during that time.
Wow. So on top of all of those surgeries, now we meet into a car accident.
Yes.
Now, did this car accident put you back into a hospital situation, or were you able to recover at home?
It not immediately, I did not go to have to be hospitalized, but at some point I realized when I was trying to get off my bed that I couldn't get up to walk. So
Mm,
I had therapy come in, but there was also a time when my back was aching so badly that I could not sit, I could not lay down. There was nothing that I could do. And then they had to put me in this wheelchair and took me to the hospital, and they admitted me for that for a couple of days and gave me injections and medications to help to relieve the pain. Then I came out, and then they gave me physical therapy again. So there were multiple things that happened during that time. And I think also the stress affected me, my heart, so that I felt like I was having a heart attack. And I went to the doctor. They admitted me, of course, because then the troponin level was elevated.
right.
They
Oh my
did.
goodness. What an ordeal. What an ordeal you went through. Wow. So at what point or what year would you say you completed the rehab from the car accident um, to reintegrating back into community, trying to get back to working again and living your life the way you want to? What year did that happen? Because
Well,
you diagnosed in 2013, you said, right?
yes.
So what
It
year did we get to a place where, okay, I feel like I can breathe again?
took me 8 years to come through all of that.
Wow, 8 years.
8 years, yes.
You're a
So,
warrior, girl. You are a warrior. Wow. Well,
yeah.
thank you so much. We are just approaching the end here, so I'm going to ask you two more questions, and then I will allow you to share any take-home message you want to share with our listeners, okay?
Mhm.
So, at this point in your journey, what would you say you're most curious or passionate about in life?
Helping others. I'm very passionate about that. And because I have gone through all of that, was always a empathetic nurse. I'm a very caring person, but at least it made me understand how they're feeling because I felt it. So
Mm-hmm.
when I'm not just doing it from book knowledge, but
Right.
I'm doing it from a personal experience. So I feel that I am more connected, as it were, with my patients when they tell me things. Because you're saying, I had chemo, I had radiation, I had breast cancer. You're saying, I'm just handing out pills, because
Mm-hmm.
that's what I'm supposed to do as a nurse. You give out the medications, but you don't know how this person feels. They have anxiety. You don't know how they feel. But when you experience it yourself, you understand exactly how they feel. And so you know what triggers certain things. And so you
Right.
can empathetic towards that. And I think you give your best care to people when you're going through that.
Most definitely. And it's so important to connect with our patients. Oftentimes in the system we're in, a lot of times it's rushed and people don't feel heard, they don't feel seen, they don't feel like the struggle matters. So having someone who can empathize, and you being someone who went through it, your own personal experience adds
Mhm.
a different level of connection and rapport that you can build with those that you are serving. And that is just so special, I think, because you are back in the trenches and you have this insight to add to the experience. So I'm sure your patients love working with you.
Yeah, because I actually sometimes tell them that I have gone through this too, and I said, you can do the same. So it's a source of encouragement. And sometimes
Right.
we want so much that after that they hug me and sometimes they literally will cry. And I feel
Oh,
the
because
tears
so
that
it's like
are
someone understands. I'm not alone. Yeah,
yeah, it
that's
really makes a
wonderful.
difference when
Yeah.
you share it with them.
And what is a take-home message that you would want to share with our audience?
One of the first things I want to say is that never delay in going to your provider when you feel that something is happening to you. It doesn't matter whether it's cancer or not, whatever you feel that, because you know your body for yourself and you know when there is a change that's taken place. So if you find the change that's taken place, go straight to the doctor. Don't delay, because my delay, and I'm sure that's caused it to spread someplace else. And if I'd probably gone faster, then maybe it wouldn't have been in my other breast, it wouldn't have been in my lymph nodes. I don't know that, but I believe, but I'm almost sure that when you delay in doing anything, then it can only get worse. It's not going to get better because it's not going to go away.
Mhm.
So that delaying, I'm saying, go straight and follow the instructions of your provider, and also communicate with them about what you want and see if you can work together in getting everything done for you.
That is great advice. Thank you so much. And finally, is there any resource or service that you'd like to share with us before we close?
Yeah, well, I have developed a YouTube channel, myself and my sister, because of what I've gone through, and it's called this Taylor Sisters Health and Wellness channel on YouTube, and I put out some information regarding to the juicing that I do. And also,
Wonderful.
I am also a diabetic educator. So I help people with diabetes as well, because I develop a program since I'm at the center as well, and that's what we do and care for our diabetic patients. So anyone that is having any of those challenges, they can also reach out to me.
Wonderful. Please be sure to share the link and I will put it in the comments so everyone can benefit from what you are offering at the end of the show. Now, in closing, I just want to share with you all as well that Freedom Wellness Physiatry has a YouTube channel, and there's an episode specifically on breast cancer where I talk about axillary web syndrome, which is a complication that can happen after breast cancer surgery, and some of what Grace touched on in our conversation. So that might be helpful for anyone who is dealing with that now or concerned about that. And I'm trying to think if there's anything else I wanted to tell you. I think that's it. So I'm going to close and just thank you for being here with me today. And I want to thank everyone for tuning in to Thriving Through Trials. If you've been inspired by the incredible stories shared on this show and would like to stay connected with us, make sure to follow us on all your favorite social media platforms. You can find us on YouTube at Freedom Wellness Physiatry, Facebook at the same, LinkedIn, I'm listed as Dr. Samantha Benjamin Allen. And remember, if you are a loved one or in need of our specialized services, don't hesitate to reach out. We're here to partner with caregivers and help those facing severe debilitation achieve greater mobility, independence, function, and quality of life at home. Simply visit our website at www.freedomwellnessphysiatry.com or give us a call at 240-339-5377 to book your appointment. Your journey to thriving begins with a single step, and we're here to support you every step of the way. Thank you so much, Grace, for being here, and thank you all for joining. Bye-bye.
You're welcome. Thank you for the work you do. Bye.
Bye.